Well, good morning, colleagues. I am aware that you have been sitting for a very long time, so if any of you want to stand up and sit back down again, please feel free to do that. Working with children, I know that we often ask them to stand up and just wiggle and sit back down again. So if that helps, please do so. So yes, it is lovely, colleagues, to be here, and I do feel that I can call you colleagues. I feel I have got to know you over the last couple of days, and I want to thank you for inviting me and for making me feel so welcome. I am a social worker to trade, and I was sharing with some people last night that I celebrate a particular anniversary this week. I will be 40 years a social worker, so it's lovely to celebrate that in Moldova. Thank you. I work for the organisation Social Work Scotland, and I should probably, I should probably just explain that Social Work Scotland is a membership organisation. It's the leadership organisation for social work and the social work profession within Scotland. So we support the emerging leaders and the leaders, and we work with national and local government to influence policy and to think about how that policy can be put into practice, how it will work on the ground. And sometimes we are saying, that's a lovely idea, Scottish Government, but it might not work in practice. I want to also just bring you greetings from people in Scotland, from both the social work population there, but also from the Scottish Government. We had the privilege of hosting a study tour of 16 people from Moldova last year. We learned so much from that collaboration, and it's a pleasure that that relationship is still continuing. So I'm going to tell you a little bit this morning, hopefully, a little bit about the story of children's services reform within Scotland. And I want to talk about our transformation journey very, very briefly, and just to highlight one or two aspects of that, bits round about policy and practice and the framework that we have adopted. A little bit about some of the factors that have improved outcomes for children who are in our care system in Scotland, and a specific aspect around about workforce and the role of social workers. And that's partly because if you understand where you have come from, it makes it easier to know where it is that you want to get to. So, a very brief history lesson. If we go back to the 20th century in Scotland, we had a system of care which was not the same, but does have some similarities to what you are facing in Moldova. And the start of our improvement journey actually began in 1968. It began with a groundbreaking piece of legislation which brought lots of disparate social services, some delivered by local government, some delivered by the third sector and NGOs. It brought them all together into social work departments. And those social work departments were based within our local government structure. Scotland at the moment has 32 local authorities, local government areas. Of particular significance is that no matter what the need for children, whether it was a care need or whether it was an offending need, everything was dealt with within the same structure. Some of you might have heard about our children's hearing system, which is a core part of our childcare structure and the functioning round about it. The reason for that is because there was a recognition, even at that point, that how children are impacted and how they display the impact of that trauma in their lives. You might see it in different ways, but the core is that trauma. One young person might act out in conflict with the law. Another young person might internalise that, show their distress in a very different kind of way. At that stage, about 50% of our children in alternative care were in a residential setting. These were small houses of about probably 20, maybe maximum 25 children. And the other 50% were in foster care, which at that point was an unpaid alternative care model. We jumped very quickly from there to 1995. And in 1995, Scotland introduced the concept that you have heard about already over this conference of a child in need. And I want to say just a little bit about that, because a child in need was a child who had any kind of need. So it might be a need for protection, might be a need because they were exhibiting offending behaviour. It might be a need because of disability or some other cognitive issue that was there. But if they were a child in need, they had a right to have an assessment and a right to have those needs then met. And that's a significant pillar of the system that we have in Scotland now. The duties for providing that assessment of need and the care sit within our local government structure. Whoops. I'm jumping very, very quickly here, but for the sake of time. When we move into the early 21st century, that foundation was really well established. But what happened in the early 21st century was a plethora of research and evidence that showed us that we actually needed to do an awful lot more. And that research and evidence base led to our policy. It's more than a framework, but our policy foundation in Scotland, which is known as Getting It Right for Every Child, often abbreviated to GIRFEC. And I will try to say Getting It Right for Every Child, but I know I will slip into saying GIRFEC. And what is really important about this is that it was based on evidence, and that it was a policy which was put into a practice across all local authorities within Scotland. And once we had got to that stage, it was then placed into legislation. And I think that's an important point to remember. You can legislate for lots of things, but if you do not pay attention to implementation and how that works in practice, then actually a good intent will fail. So that's one thing. Scotland's got many things wrong, but that's one thing that I think we got right. And the core message within GIRFEC is meet need early, early identification. We've heard about that already, particularly in the early years, but not only in the early years. Support to families, that concept of what can we do to help families to be able to care for their own children, and the importance of working together. We just heard about levels of intervention, and part of the GIRFEC model is a tiered approach. Universal services supporting children and families as much as they possibly can. Where that is not sufficient, there is a need for targeted services. And for some children, there will be a need for specialist services. But if we get our universal services right, if we are working across disciplines and across services, then the number of children who require targeted or specialist services should be fairly low. So of crucial importance is working together, working across disciplines, multi-agency working. I made lots of extra notes after yesterday's presentation, and I know I'm probably going to drop them at some point. So I'm not going to go through this, but that is at core the GIRFEC model, the national practice model. And I will just point out that in the circle are what we call the wellbeing indicators. These were well based on research and evidence, and every child, that's what they need to thrive. We want them to be safe, healthy, achieving, nurtured, active, respected, responsible, included. And if those well-being needs are met, they will grow up healthy. And what we have to do where they're not being met is look at what is it they need, and what are the resilience factors, what are the strengths, and what are the not so strong factors that will indicate what intervention needs to be given. Moving on quickly to some of the impact of what that framework has had. And I've put in a quote there that became common in Scotland over time and is still used just now. It's the concept of shared responsibility and the fact that it is everybody's job to make sure I, the child, am all right. Everybody's job. Not just the teachers, not just the social workers, not just the health or the mental health profession. It is a shared responsibility. It is everybody's job to make sure that I am all right. And Scotland's not a big country. We have a population of about 5.5 million, but because of that, we have quite a strong community ethos, and I think that I am hearing that the same is the case in Moldova. And GIRFEC is something which just underpins and formalises that ethos. Shared ownership, and I can't underline that enough, multi-agency working across disciplines. It resulted in a reduction in the number of young people we have in residential settings and a huge increase in family and community supports to avoid children coming in to our care system, but also to support those who are in the care system. So a child in foster care still has access to all the community supports round about. And our residential houses, as we call them now, are very small. They are young people of maybe 4 to 6. We wouldn't generally have any young person under the age of 12 in a residential setting. That is not always possible. Sometimes children's needs are so complex that we will have younger children there, but most children go into foster care or kinship care rather than going into any residential type setting. There are a few statistics here. We have many statistics, and if you're interested in statistics, please speak to me afterwards. But in 2021, we had 13,255 looked after children in the care system, and that was an 8% decrease from 2020, a 20% decrease since 2021. We are still on a journey. I said earlier there are many things we haven't got right. We still have the highest population of children in care of the 4 UK nations, and we still have areas of ongoing concern. We have seen a huge increase in neglect over recent years. We have an ongoing problem with domestic abuse. Some of you might know that we are the drug capital of Europe, which is something to be ashamed of. We have seen a big increase in mental health issues amongst caregivers, but also amongst children, particularly over the pandemic. And we are increasingly seeing exploitation of children and young people. Our current improvement agenda, excuse me, is something which is called the Promise. It's based on the UNCRC, and the Promise is a promise that has been made by the people of Scotland and by the Scottish Government to our children. And that promise is that they will grow up loved, safe and respected. It's a 10-year programme. It's the output of a very extensive 3-year review of our care system, which identified the human and the economic cost of not getting care right. And that has been a thread that's been through this conference over the last couple of days. That 3-year review, you can read about it on the Promise website, but at the heart it had young people. They set out to speak to 1,000 young people who were in the care system or who had a previous experience of the care system, and they actually spoke to 5,000. They included in that how they were able to represent the voice of young people. They used advocates. It was a very extensive review. And there are 5 foundations that have come out of the Promise. Again, I'm not going to speak to this, but you can see that the symbol of the Promise is a heart, and that within the heart there is a heart in the middle. And that heart in the middle is voice. It's the voice of lived experience. It's the voice of children and young people who are experiencing our care system. And the other foundations are family support, which we have heard about, care, which is the quality of the alternative care that we are giving to our children and young people, scaffolding, which are what are other things that need to be there to support our care system, and people, and that's the workforce, and that's the bit that I've been asked to just say a little bit about just now. So I'm going to start by talking about social workers. I am a very proud social worker, proud to be a social worker. Social workers in Scotland are a registered profession, so we cannot practice if we are not registered with the Scottish Social Services Council. It's a protected title, so you cannot work as a social worker if you are not registered. You can't call yourself a social worker if you are not registered as one. You need to hold a particular qualification at the moment. That is a 4-year a 4-year degree or the equivalent. There are other aspects to that. People can do masters, there's other entry levels, but you need to reach that standard of education in order to be able to register. We operate to a code of practice, and that code of practice is about how we behave, how we operate, relationship-based practice, honesty, integrity, standards that you would expect in a code for a professional group. There are some protected functions, and these are primarily around complex assessments and aspects of care planning. And just some figures there which you can read for yourselves about the number of registered social workers that we have and the number who work within children's services. So there's just under 3,000 work within children's services, and the majority of social workers work within our local government structure. We're not the only part of the workforce. The social workers are supported by a huge number of what I've called for ease paraprofessionals, social work assistants, family support workers, early years workers, people who work with young people who are offending or with drug and alcohol. So there's a huge number of people who are part of the social services workforce but might not be an actual social worker. So just to say a little bit about where we are just now. Social workers now in Scotland have a very kind of core key function in our public protection agenda, not only with children, also with adults at risk or with high-risk offenders and adults. We're responsible for the identification, the assessment and the protection of people who are at risk of abuse or neglect or who are vulnerable for other reasons. We have what we call the minimum intervention principle, and that means that you don't intervene if you don't need to intervene. And if you do have to intervene, then you use the lowest level of statutory intervention that you can to achieve the desired outcome. And that's very important. Public sector social work does play a very crucial role, but in managing and balancing those risks. And the role of a social worker is also quite complex. And we also have a whole thread of work at the moment, which is about reclaiming our professional identity. Somewhere along the last 10 or 15 years, social workers have lost some of the respect that they used to have in Scotland, I think probably in the UK, and we're working quite hard to try and rectify that. So social workers are the glue. This was a term which actually Ludmila used when she was in Scotland last year. The glue that holds that multi-agency team that I spoke about together. So we have each child, regardless of their range of needs, will have one plan. So one child, one plan. And there might be many professionals involved in what needs to happen to meet that child's needs. But there will be a lead professional, and quite often that lead professional is the social worker. So they have that coordination role. Doesn't mean they do everything. In fact, often they only do small parts of it, but they will have that coordination role with the other disciplines. And because everybody has signed up to GIRFEC, whether it's a teacher or a health visitor or a drugs worker or whoever else might be around that table, they are all signed up to working in that particular way, and that is a strength within our current system. There's a unique position at the moment amongst those who are vulnerable in society, and I've often said to people, social workers are only interested where there's a difficulty or where there's a problem, and that can sometimes be a lonely place to be, but oh my goodness, it is such an important place to be. It's important that somebody is there when people are down and when people are vulnerable. Social workers also in Scotland have quite an odd position. They can challenge the system. So they will, on the one hand, be advocating for the needs and the rights of the children that they are working with, but they're also an agent of the state in the terms of all that protection. And that seems odd, but I have to tell you, for some reason or other, it works. And I think sometimes that tension is what makes some of it work. Yeah. And just very quickly, I want to say just a little bit more about the workforce. We have a national work plan in relation to workforce. And you can read there the different aspects of that. There is the bit about shifting the public perception, increasing status, and the rest are very much about what do we need to do to support the workforce. And what are the pushes that push social workers out of the profession? What are the pulls that bring them and keep them in? So these bits are all about improved data, about support, about recruitment and retention of social workers. So just to kind of finish up, I want to say just a little bit about, we are proud of the journey we've taken. We've made lots of mistakes. If we can help you in Moldova not to make the same mistakes as us, then we're happy to share that, to tell you what's not worked and what does work. But Scotland has moved from a very paternalistic approach to care back in the mid-20th century to a very participatory approach with voice, lived experience, workforce right at the centre of what we do. But each phase of that change has required a level of adaptation. Could we have done it quicker? Perhaps we could, but perhaps we couldn't, because you do need time to change. GIRFEC is right at the core. The promise is right at the core, the heart, the voice of young people. And essential to that is the fact that if you support your workforce, as we have heard already, then that will improve care, that will improve children's lives, that will result in financial and economic rewards when those young people become adults and parents themselves. And I think one of the things I would just like to reflect in closing is I've been so impressed over the last couple of days by the commitment of the people that I have met, from politicians through to practitioners in Moldova. And there is a saying that says, where there is a will, there is a way. And I'm very clear that there is a will. There is a will in Moldova to transform your childcare system, to make lives better for your children. And I think there can be no greater compliment to a nation than that their society cares and cares about those who are most vulnerable. Children's lives are transformed by that care. So I want to pay you that compliment. You care, and because you care, you will get where it is you want to be. So thank you for allowing me to be here for those 2 days. Thank you for letting me be a tiny part of your journey, and all the best for the future. Thank you.
Thank you very much, Vivien. That was really very helpful, very interesting.